All right, work me through this question here.
Okay. Do you want me to like tell you where my thought process went
Yeah,
wrong or just like start from the top?
I guess kind of when you were working through this question, kind of where, work me through kind of how you were thinking and how you ended up with A, or I mean, I guess D, hemophilia
Yeah.
A.
Honestly, the question confused me when I read it because I
Sure.
didn't really understand what the PTTs prolonged but corrects after the addition of the plasma from a patient with hemophilia A. I was I was thinking of that test that they do to differentiate hemophilia A from like the antibodies against factor 8. I forget what it's called. And so that's what I was like thinking of, and then that other one wasn't really an option. So then I just kind of went with hemophilia A. When I read the explanation, it made a ton of sense though, because it's like if you're deficient in factor 9 and you give someone factor 9 in this roundabout way, that'll
Yeah,
fix the hemophilia B.
yeah, that's the trick question, right? So I would always say here on a test taking strategy, right? Um, just almost on a blanket statement. I've never seen this incorrect, but if the diagnosis or the answer is said within the question, then it's unlikely the answer, if that makes sense.
Yes.
Right.
Yeah.
So they said hemophilia A, so highly unlikely the answer is hemophilia A, right?
Yeah. When I got
Yeah.
it down, I knew it was one of the hemophilias because if like bleeding time is normal, that like got rid of F and G because those are platelet disorders.
Mm-hmm.
Um, I knew it wasn't a factor 5 or factor 7 deficiency because it was the PTT that was prolonged.
Mm-hmm.
And
Mm-hmm.
then the DIC didn't make sense.
Yeah, DIC would be everything would be messed up, right?
Yes.
So yeah, you get it between D and E, and of course, if someone has hemophilia A, right, they have the factor that hemophilia B is missing, right? So that's the tricky thing that they're trying to get you to think about.
Yeah.
All right, let's move to the next one.
All right. Yeah, I think this was just another one where I didn't like I read that it was the enzymes necessary for the replication of the genome, and then I couldn't decide if those enzymes were made before they actually started replicating the genome.
Sure, sure. Yeah, this is more of a, basic science kind of memorization
Yeah.
kind of ordeal. And then um if you miss it, you kind of learn from it and then move on, so
Yeah. I just kind of like slapped myself in the head for that one, but
gotcha, gotcha.
yeah, this one I just made a math error. I actually had the formula down correctly, and then I didn't do the math correctly.
Gotcha. Okay.
Yeah, like I had what was it? It was 60 over 80 divided by 40 over 120.
Mhm.
Um, and then yeah, I did four. I got rid of my zeros and then did 4 times 8 and did that wrong. So
Gotcha.
go
Gotcha.
back to elementary school for a minute.
Yeah, I would say just do the fractions individually first before you redivide them, if that makes sense, right? It
Hmm.
makes it a lot easier. You know
Okay.
what I'm trying to say? So if you do
Yeah.
60 over 80 and you come up with a number, and then you do 40 over 120 and come up with a number, and then you take those and then redivide rather than, having all the fraction over a fraction, right? Which
Yeah.
can, make up your errors with math, right? So you just kind of do one thing at a time and then redivide at the very end. So
Yeah. I think too, if I had double checked my math with a calculator,
yeah,
that would have helped too. Because
for
I like
sure.
doing it by hand because it takes way less time. But
Mm-mm. Yeah, just make sure,
yeah, it's better to take a little more time than to get it wrong.
exactly, exactly.
Okay, this one, as I was reviewing it, I actually still don't really understand clearance all that well.
Okay.
So like I was looking at like the graph and I wasn't so I understood that like that it maxed out, that the secretion maxed out regardless of the concentration where the curve, goes to 0, but I
Mhm.
wasn't really sure how that was all related to clearance or anything.
Okay, let's see here. Based on the graph, pH concentrated versus pAH secretion, which of the following is lower at point Y than point X? Um, trying to remember this graph. I haven't seen one of these in a long time. Let me think. pAH concentration versus pAH secretion. So you're clearing it and then you're going to hit max there. Indicates that the point indicates that plasma concentration, which is big, higher, which is maximum beyond the concentration, unable to clear any additional point. Why there's the clearance of the. Oh, this is really, really stupid. Okay. So the reason why I'm saying it's stupid, it's a how do I say this? Syntax thing, a wording thing. Okay. So what they're trying to say is that although like the rate of clearance, right, is higher at Y than X, the overall clearance is less
Oh,
because there's more concentration of it. You get what I'm trying to say?
yes.
It's
That's
kind of really stupid, right? Because when you're thinking about clearance, you're talking about a rate, but
yeah,
they're trying to say that the clearance of PAH, because there's 60 of it, you're only decreasing it by a marginal percentage because there's so much concentration.
gotcha.
Yeah, so
Makes-
this is a bad question, is what I'm trying to tell you.
Well, I appreciate that makes a little more sense because I was like, the rate is still lower at X.
Mm-hmm. Yeah, that's the issue here. They don't really clarify what they want you like, because when you think about clearance, you're really thinking about the rate, but because they didn't say clearance rate, they just meant like the clearance as in the total amount of PAH versus, right, subtracted the amount of rate that's getting cleared, right? So that means that you're going to have overall PAH that is not cleared more than X, right? Which is you're clearing almost all of it, right? Because you haven't reached that max threshold.
Yeah.
So, yeah, it's kind of a bad question, but does it make sense kind of what they're trying to go for
Yeah.
here?
That they're basically saying that at X, almost everything is getting cleared because they haven't reached that max concentration. But at
Yes.
Y, there's going to be a lot of extra PAH because it can't
Yes.
handle it.
100%.
Yeah.
So,
Okay.
kind of really stupid, but yeah.
I understand the idea at least. I don't think I'd get it right.
Yeah.
Okay. The ovarian tumor is derived from which of the following cell types? And then I just looked at them. Precocious puberty, a mass consistent with ovarian tumors, decreased concentrations of gonadotropins, and an increase of estrogen. So basically, I was looking for a cell that produced estrogen and
Mm-hmm.
would then go up to do negative feedback. Um,
So let's talk about this before you kind of look at the cell itself. What's the diagnosis usually?
um, so
It's like
some,
granulosa cell tumors, right?
yeah.
They like to secrete a bunch of estrogen.
Hmm.
So if you're give you an example, right? And you know, 5-year-old girl with a bunch of estrogen, she's gonna hit puberty faster, right?
Yeah.
Also, you know, might have bigger breasts, right? Might have pubic hair, all this stuff at 5 years old, which is, you know, precocious puberty. And then you have elevated, right, amounts of estrogen, and you have sometimes a mass, right, on ultrasound that you can see. So that's when you know it's a granulosa cell tumor. And they like asking this a lot.
So, yeah. And then why would it not be a thecoma?
Um, the luteal thecal cells. I don't know if those go down. What do they say for E?
I think they just said that it was less common.
These tumors also produce this postmenopausal, but less likely than grain. Yeah, the reason why I don't remember Tacoma is because they don't really. I think it's pretty rare. I mean, you probably
Okay.
knew a piece of information that I didn't know. I don't think I've ever picked fecal cells.
Okay.
Um, it's just not as common, I guess. Your answer is probably not incorrect. It's just more correct that it's granulosa cell tumors. Um, but also on top of that, talk to me if you have a granulosa cell tumor, what uterine cancer are you increased risk for?
I have no clue.
So think about the mechanism, right?
Yeah.
It
Too much estrogen.
yep. So what can that cause in your uterus?
Are you talking about like fibroids?
Fibroids not too much, but how about the endometrial layer? What happens there?
Does the endometrium grow with progesterone? Or does it grow with estrogen?
It starts to kind of grow with estrogen, a lot of
Okay.
estrogen. Yeah, progesterone kind of solidifies and kind of starts kind of your period after, but your estrogen will build that thick like layer, right? And so if you have a granulosa cell tumor, sometimes they'll say that they'll ask you like, oh, what are you at increased risk for? And that's going to be endometrial carcinoma of the uterus.
Okay. That
Yeah,
makes sense.
yeah,
Would it also would it also mess with like breast cancer's risk?
yeah, exactly, right. You can also increase risk for breast cancers too, of course. Um, of course, the ones that are, estrogen, what is it called? The estrogen receptor breast cancers,
Hmm.
definitely. But I think the main one is going to still be your endometrial layer because it's always going to be reactive to estrogen, right? Breast cancer sometimes, are estrogen kind of independent depending on the receptor. So,
Okay. That makes sense. So that's just another way they would ask this question.
yeah, I've seen it asked. And just remember, kind of granulosa cell tumors. What do they ask this against? Does that make sense? These are always asked in
Mhm.
pairs, usually.
Wait, so like granulosa cell tumors versus what is what you're saying?
Exactly. Do you know what the verses is usually?
Would it be like a cystic teratoma?
No, not too much. Remember, cystic teratomas, they're going to have like all those kind of, different cell lines. So you could have hair, teeth,
Yeah.
etc., right, in the tumor. But this one, remember, this one secretes estrogen. Which one secretes testosterone?
Oh, would it be in the adrenal gland?
No, it's going to still be an ovarian cyst. Actually, it starts with an L.
Oh, okay.
What is it called? Hold on, I gotta remember. So you want to learn things in pairs because that's how they're gonna ask you, right?
Yeah.
So ovarian tumor that secretes testosterone. What is it called? It's called. I know it starts with an L. Leydig something. Leydig. What is it called? Leydig cell tumors.
Isn't that in boys though?
No, you can have it in females too.
Oh, okay.
Yeah,
That
they're
makes sense.
just these are just Sertoli Leydig, sorry, Sertoli's Leydig cell tumors. If you
Okay.
remember kind of how that looks like. Um, but yeah, just remember that granulosa cell tumors they secrete estrogen. Sertoli Leydig, you can have an ovarian tumor that's a Sertoli Leydig cell tumor that secretes testosterone. So, what symptoms would a female have if that's the case?
They'd get like hair on like the chin or chest or
Mhm.
um if they're young enough, could they get like clitoromegaly?
Yeah, exactly. Right. So you're talking about hirsutism or virilization, right? So yeah, these are kind of how you're thinking about these, right? And so you learn them side by side because that's how they're going to really test you, I would say.
Okay. That makes sense.
Mhm.
Okay. Okay. When I read this question, I was originally thinking of something like polyarteritis nodosa as my
Mhm.
diagnosis. So then when it wasn't there, I had no clue what to go with.
Mhm.
Um, I mean, when I read about it and then I like looked up polyarteritis nodosa, like compared to it, and it looks like they're very, very similar. So,
Yep. Yep. They're pretty similar, I would say. Um, I'm trying to think, is there anything else that I can help you with here? Alternate stenosis beats on a string sign, which is the following renal artery. No, I think that's the main thing, right? That you had to know that there's multiple things that have beads on a string, right?
mhm.
Um, Once you kind of know that, then it gets narrowed down to fibromuscular dysplasia. But okay, let's go to the
Yeah.
next one. I don't know if
Okay.
there's too much here I can help you
No, it's
with.
it was a little bit like you know the diagnosis or you don't.
Yeah.
Okay. Here basically I didn't connect the whole sepsis thing with the excessive production of nitric oxide. I
Hmm.
thought potentially it could be like an EHEC version of E. coli, and then that could maybe lead to some hemorrhage, but I think that's just way less likely than shock sepsis.
Yeah, definitely. It's definitely sepsis is more likely, right, when you're infected, right? There's very minimal things, to be honest with you, that cause internal hemorrhage. Just very rare, right? Besides trauma and um something like esophageal varices that pop, right?
Mm.
But not many things will cause you massive hemorrhage and die. Usually, things with any kind of infection is almost always like, dilating your vessels, right? Your third spacing, right? You can't keep your blood in your vessels, right? Um, you know, septic shock is kind of that's how it works, right? You technically have all your blood there, it's just not in the right place, right?
Yeah.
All right.
Okay. Um, yeah, I flat out when I read this, I wasn't sure. So I just picked one. It made sense when I read it though, because I picked macrolides and macrolides work on the 50S and aminoglycosides work on the 30S. So why would they have synergy together?
Mhm, mhm,
Um,
mhm.
but I mean, I think this was one where you either knew it or you didn't.
Yeah, this one you didn't, and if you're having a little bit of difficulty, remember some of these things for antimicrobials. Um, I say that in the future you can kind of take a look at sketchy microbials. I always find those. I mean, the original sketchy micro was just micro, and also the antimicrobials. Those are pretty good, I would say, if you want to use them as flashcards to memorize. But yeah, I think this was in one of the this is the aminoglycoside sketchy, and it had this in there.
Hmm.
All right, let's go to the next one here.
Okay. Yeah, so I
Again,
saw
psych,
one of the
right?
cyclovirs. I was immediately thinking of the thymidine kinase, like in that,
Mm-hmm.
because I've seen the sketchy for it, like acyclovir and stuff, and I
Mm-hmm,
just
mm-hmm.
got it confused with what it actually does.
Yeah.
In
Yeah.
that CMV doesn't have thymidine kinase.
Yeah.
So,
Yep. All right.
um, keep going. Yeah, this one. So I go through it and I see like I don't know why this is. I thought I highlighted the third. I thought I highlighted these. I think the highlighting
Yeah, the
changed.
highlighting is usually really off when you review it, so it
Okay,
should
because
not be
I
an issue.
did. I had like this highlighted and then this. I think that's what I had. Um. So when I saw this, so I was like, okay, they're not. I didn't know what to exactly to make of the arterial O2 and the venous O2, but I saw the PCO2 was decreased because it should be around 40. And so
Mm-hmm.
then I was thinking about shortness of breath, maybe some sort of like hyperventilation and respiratory alkalosis. Um, and then I basically took away, so that kind of left me with, I think, C and E. And I took away this one because I figured since it's a 2 week history, after about a week, altitude sickness should kind of resolve itself. But as I read through the answer, it made a lot more sense because we're decreasing our oxygen carrying capacity. I
Yeah.
just don't typically associate anemia with shortness of breath.
Yeah, yeah, yeah. So, yeah, yeah. It's kind of like what is the you're trying to fit the whole picture, right? Pretty
Yeah.
much, right? So your picture is it doesn't fit everything, right? Because hyperventilation will decrease your CO2, but it's not going to decrease your arterial O2 content.
Hmm.
Right. So that's one of the main things, right? Figuring out what it practically the question really here is do you understand what arterial O2 content is and what it's composed of, right?
Yeah.
So you're talking about hemoglobin and then connecting, right? Hemoglobin and the heme molecule being able to attach to O2, right? And so if you don't have enough hemoglobin or the heme, right, portion of it, then you're going to have issues with, carrying the adequate amount of oxygen through your blood. That's practically what they're asking you.
Yeah. It made a lot more sense when I read the explanation and realized what they meant by arterial O2 content.
Yeah. Gotcha. Gotcha.
Okay. So I knew infliximab was a TNF alpha inhibitor, but I actually had no clue what TNF alpha did besides cause fever. It
Okay.
that was just as simple as that. I think if I had like looked back at it for maybe like looking at the tuberculosis, I could have
Mm-hmm.
gone to granulomas if I had like pieced that all together. I
Yeah.
think that
So
would have been a way around it.
yeah. So one of the key things is oh man, I haven't gone through this in a little bit, but so TB, you have to know kind of the whole pathway of TB. Let me see if I can remember it. So, do you know how TB works or how your body walls off TB and kind of do you remember how to work all that by any chance?
All I know is it forms granulomas.
Yeah, so you have to know the whole immuno project, immunopathway, because it's super important. I'm pretty sure. So if you can write this down, I wish I can draw. Let me see if I can.
I can also stop my share if
Yeah,
you need.
stop your share. Let me see if I can draw this. I'm gonna try my best here. It's been a. So let's see how good my memory is. Um, okay, so I'm gonna share. Let's see. This should be share whiteboard. Can you see that? Okay.
Um, I can. Okay, it's loading. Now I can.
Okay, perfect. All right. Um, okay. So let's say you have a TB molecule here, right? Okay. I'm pretty sure you have your what is it? CD4 helper T cells.
Mm-hmm.
Okay. They will then talk to your macrophages. Do you know what they how they talk to the macrophages by any chance?
No.
I'm pretty sure it's TNF alpha.
Okay.
Okay. Pretty sure. I have to check up on this. It's been a long time since I did this. It will then talk to the macrophages with the by secreting TNF alpha. TNF alpha will then attach to the macrophage and then turn it into a epithelial histiocyte or a giant cell, right? So if you can imagine, these macrophages are now giant cells or epithelial histiocytes is another fancy term for them. Okay. And then they wall off the TB and cause granulomas, right? So why is this important? You have to know this because this is how a TB reaction happens. This is, like when you do your TB test, this is kind
Mm-hmm.
of, they'll ask you about this. This is the same kind of reaction for um what's it called? Lepre. Is it Mycobacterium leprae, right? It's the
Yeah,
same.
for leprosy.
Yeah, leprosy, right? So same kind of for TB and leprosy is kind of the same way your body fights it off or walls it off. So why is this important for the question that you just took? Well, if you take a TNF alpha inhibitor, you cannot make granulomas anymore. So now the TB is reacted. You get what I'm saying? Something that you
Mm.
might have protected yourself against, right? And controlled it, but now your body can no longer control it because you can't make giant cells anymore because your TNF alpha is blocked.
Gotcha.
Does it make sense?
Yeah, it does.
Perfect. Okay, I
Um,
don't know how to clear this stupid thing, but close whiteboard. Okay, I'll have you share again, but just make sure just make sure you fact check me. I'm pretty sure that's correct. It's been like maybe a year or two since I went through that, but that's a very very high yield. That's how they ask that. Pretty sure
okay.
TNF alpha activates macrophages. I'm pretty sure.
I can see.
Yeah. Oh no no. Addition, however, active only after priming with interferon gamma. Okay, so I think it's interferon gamma. So it's actually interferon gamma with TNF alpha, but that's why I wanted you to fact check me because I couldn't remember exactly.
Is it interferon gamma that activates the macrophage and then TNF alpha leads to the, or are they working together?
Let me see macrophages. I think that let me see, hold on. I think it's TNF alpha that activates the macrophages, but no, interferon gamma does. Sorry, interferon gamma activates the macrophages, but TNF alpha does something else. I think that's just a regular reduction of TNF alpha. I think macrophages activate TNF alpha is what I'm reading.
Because when you mentioned interferon gamma, it reminded me of interferon gamma activating macrophages as like a general thing it does.
Yeah, yeah. I think that's the case. I think TNF alpha is secreted by probably the macrophages to help kind of stabilize the cause an inflammatory reaction. So
Gotcha. Yeah.
Yeah. Okay. So just, like I said, I figured that's why I wanted you to fact check me because I was like, I feel like I'm missing something, right? So I think it's the TS the CD4 cells secrete interferon gamma activates macrophages then secrete TNF alpha. I think that's the whole thing to create granulomas.
Gotcha. That makes sense.
Yeah.
Okay. This was dumb. There was literally all the symptoms of asthma, and I saw the mid-systolic click at the apex. So that's why I picked it. But reading through it, these aren't even the symptoms of mitral regurgitation. We don't have, it's usually asymptomatic. I shouldn't have missed that.
Yeah, so this one, going back, Aaron, I think that you did a good job recognizing, but you want to pick the thing that supports it the most, right? Even though one thing it might be weird, you're gonna want to pick the exercise-induced asthma because likely she also has a mitral valve prolapse, but that's not what's causing her symptoms, right?
Yeah.
Okay, perfect.
Okay. Yeah, so I think this one basically asked how heparin works, and
Mhm.
um I knew that heparin inhibited thrombin, but I didn't realize it was through antithrombin 3.
Yeah, yeah.
I thought it was a more direct process. So it was one of those things where I just didn't know it.
That's okay. That's okay.
So,
You just kind of put it in your memory and then kind of move
yeah.
on.
Move forward.
Hmm.
Um, yeah, I always get kind of confused on what fluid ta intake and inadequate fluid intake and the roles on sodium. I mean, I recognized it was hyponatremia, but then I was confused.
Okay, let me see here. 22 collapsing marathon. This semi-comatose. So she's very hyponatremic. Um, cool, dry skin, just raw sensing. Yeah, so if you think about inadequate fluid intake, right? Um, if you talk about hyponatremia, then you're gonna be thinking that let me reverse this. If you are dehydrated, you're running a marathon and you're dehydrated, you're gonna be hypernatremic, right?
Mm-hmm.
Because you're losing more free water than salt, right? So you're losing more free water. So that means that people that are running marathons are usually, for the most part, right, are usually inadequate fluid intake, right? Usually, right? But it seems like this woman drank just, it seems like just a crap ton of free water, which is not good either, right?
Yeah.
Does it make sense what I'm trying to say?
Yeah, it does. I think it's just trying to sort out in my head which one leads to hyponatremia and which one leads to hypernatremia.
Yeah. So for can you hear me? Sorry.
Yes, I can.
Okay, gotcha. I think it disconnected for a little bit. So, practically what I'm saying is that usually without drinking any fluids, Gatorade, water, right? Someone that's running a marathon will likely come in with hypernatremia because they're losing more free water than salt. Okay, if that's the case, then you're going to have something like, sodium of like 150 or 160, right? But the fact that this patient is hyponatremia probably means that she chugged tons and tons of just straight water, not Gatorade or anything, but just straight water, which is really, really bad, right?
Yeah.
Right. And also on top of that, creatinine's normal, right? When you're super dehydrated, your kidneys start shutting down too, and your BUN will increase also.
Okay. Yeah, no, that makes sense now. All right. Okay. This was asking for the most likely diagnosis. Um, basically talk it describes weight loss. The Lambert it then describes Lambert-Eaton, which I failed to recognize. And then we see a mass in the right frontal lobe that has malignant small blue cell neoplasms. Um, so yeah, I mean, I really wasn't sure what was going on. But like reading through it, I was like, okay, I didn't know the histology of the small cell carcinoma to the lung. Um, and then that makes a ton of sense because once you're talking about lung cancer, paraneoplastic syndromes come in.
Yeah, yeah. Um, what is your most specific um, piece of information of this question?
Um, I mean, it also talks about expressing cytokeratin,
Yeah.
chromogranin, and
So,
sonato.
yeah, I would say the biopsy, right? Any kind of cancer question that you're doing, the biopsy is going to be the most specific. But sometimes if you don't know the histology, then you're kind of stuck with, the rest of the stuff, which might not be as, how do I say this, um, as helpful, right? Because for
Yeah.
instance, here you have 3 month history of headache, weakness, arm, flank pain, right? 14 pound weight loss, right? And she's 65, so it's some kind of cancer, right? And then right, weakness of upper lower extremities, right? So you think in paraneoplastics that deal with MSK, right? Musculoskeletal, right? MRI of the brain shows metastasis to the brain, it seems like, and then they took a biopsy of it and it shows small blue cells, which actually, if you're talking about lymphoma also looks like small blue cells, right? So you're not, in a sense, incorrect, but cytokeratin, chromatogranin, synaptophysin, those are all neuroendocrine hormones, right? So you got to pick something with neuroendocrine cell line, which is going to be, small cell carcinoma. Do you know other neuroendocrine like cancers or tumors by any chance? Because they do like asking those kind of things.
Isn't it carcinoid tumors one of them?
Yeah, carcinoid is one of them. Also things like pheochromocytoma,
Yeah.
right? Things that secrete like endocrine stuff, right? So, but yeah, in this case, right, with the musculoskeletal issues, small cell carcinoma, how does small cell carcinoma cause muscle issues?
I know it causes it through like the paraneoplastic syndrome, like Lambert-Eaton syndrome, but I don't.
Exactly. Lambert
Okay.
Eaton, right? So I want you to kind of, verbalize that, right? Because small cell, if you think about it, when you're doing a test and you're thinking about a weird collection of symptoms, probably small cell will be your best bet because it has a lot of paraneoplastics, right? It has Lambert Eaton, it has ACTH, right? It has what's the other one that has? It has
SIADH.
yeah, SIADH, right? So it has all these neuroendocrine kind of paraneoplastics because that is kind of its cell line that it's from. So
Yeah. No, that makes a lot more sense. Like, I think sometimes too, when you like look at the explanation later, you're like, oh, I see how all the pieces connect now.
sure, sure, sure.
Um, okay. Production of which of the following vitamins is most likely impaired? And then, yeah, is basically talking about tryptophan concentration being decreased, and I didn't make the connection that tryptophan and niacin were linked. So that
Gotcha.
kind of will do it for you.
Yeah.
Um,
All right, let's go to the next one here.
yeah, so reading the explanation, I see why it's low sensitivity versus an negative predictive value. I see why, because it's like talking about the first importance of being like we got to make sure that there's a high enough sensitivity to catch like specifically colon cancer in this case. The reason why I picked the uncertain negative predictive value was because I was thinking like the question with negative predictive value is if my test is negative, how likely is that a true negative? And then I was like, well, that's kind of what we're looking at, but it's not. We want to make sure we don't get a false negative, and that's
Gotcha.
where low sensitivity is important.
Yeah, so anytime you're dealing with cancer, right, you want to talk about screenings. When you talk about cancer screening, you want high sensitivity, right?
Yeah.
And if that comes back positive, then you want to follow up with a test that's more specific. You know what I'm trying to say?
Yes.
Um, that's the key, right? When you're talking about cancer screening, that's really you're trying to create a test that's so sensitive that it catches like anything that's remotely possible to cancer, right? So
Hmm.
if you have low sensitivity for cancer screening, that's a pretty bad screen because you're going to miss cancers, which is something you never want to do, right?
Yeah. Right.
All right, let's
Okay.
go to this one here.
Yeah. I did not know what this was, so I just picked one and moved on.
Gotcha, gotcha. Um, Treatment is initially aspirin and drugs in his apply for uh, abiximab. Yeah, this is just this is just what is it called? Got to memorize kind of
Yeah.
your pharmacology, of course. Um, but yeah, they all look the same. I remember this question. You just have to. I know it's just a lot of memorization, of course, but clopidogrel and aspirin, they're very similar to kind of how they work. But they'll ask you some of this with adhesion versus aggregation. So,
Mm-hmm.
all right, let's go to the next one here.
Okay. Yeah. So I understood the idea that we were just trying to regenerate cells, and that's what it was talking about.
Hmm.
I'm so sorry. I'm gonna have to take a call really quick.
No, that's okay.
Sorry about that. It was two calls in a row from my dad, and I thought it might be an emergency.
No, that's okay. Everything okay?
Yeah, it's fine.
Okay, okay. No, no one's, no.
No one's dying. We're good. But that's why I took it because I thought someone might be.
Yeah, no, that's okay. All right.
Okay. Yeah, I didn't. I mean, when I looked at reading the explanation, I was like, I now know how cells are regenerated. Um, yeah,
Yeah,
I
they're
didn't
just
realize.
in spaces. Yeah, they're in
Yeah,
stasis a lot of times.
yeah. I thought because I was like, I thought that most cells got sent into GO when they were like not good. Like that if you didn't pass the checkpoints from going to G1 to S, that was when you went to GO. So I think there was that misconception too.
Gotcha, gotcha. Yeah, just understand kind of some of these. They call it in quiescence, or these cells are on backup and just sleeping. So, a lot of times that's how you regenerate tissue.
Yeah. Okay. Um,
And remember, there's only a certain amount of organs in the body that can do that. Liver, kidney, you just check for me for, like, for instance, your skin and your GI tract too has mucosa layers that can kind of regenerate also, but I'm not sure if it's by the same mechanism, so
okay.
it could be slightly different.
So
um
for sure, hepatocytes and renal tubular epithelial cells, but not necessarily.
yeah, your skin and then your mucosa from the GI tract, those will replicate pretty fast because they have this basal membrane, right?
Yeah.
But remember things like your heart, right, your brain, right? Those things cannot regenerate, which is why when you
Yes.
have a stroke or a heart attack, right, that muscle just is dead. Once it's dead, just becomes scar tissue, right? Which is important, right? Because that's why, when you have a heart attack or a stroke, you're kind of, it is what it is, right?
Yeah.
But if you have issues with your kidneys or your liver, or you get a cut on your skin, right, those things can regenerate. So,
Okay. Yeah. Okay. This one, um, I knew the great saphenous vein was up in the thigh, so I picked something closer to the thigh than any of these other ones.
mhm.
Um, but yeah, I mean, I get it's just an anatomy. It's on the medial side of the leg, so medial side of the ankle joint would also get you to the great saphenous vein.
Yep, just
Okay.
anatomics.
Yeah. Um, yeah, so this one, first of all, I did not realize that the partial deletion would also lead to Turner syndrome, but I just didn't recognize it as androgen insensitivity syndrome. If I had, I would have picked it.
Okay,
Um,
the best
I,
way for me to remind, I always remember that females, or I mean, phenotypically males that are, no, genetically genetically male, but phenotypically females that are androgen insensitivity, they are structured like a model. Okay, that's how I remember it. They're usually tall, they're usually skinny, they don't have any hair, right? And their breasts are usually you know big because they what is it called, the testosterone converts to estrogen, because you can't use the testosterone, so you overproduce it, and then the testosterone then converts to estrogen, which then has breast development. So pretty much everything you'd want in a model, right? Super tall, big breast, skinny, no hairs, no hair anywhere. right? That's how you remember androgen insensitivity. And I think there's some models that came out that said that they are actually genotypically XY, but phenotypically obviously female. And these women, right, they can't reproduce because I think I want to say they have yeah, they have like a blind pouch or a blind vagina, right? And obviously absent a uterus and fallopian tubes. And some of them will have undescended testes too that you have to remove.
Yes. Yeah. I
Does
think,
it make sense? Kind
yeah.
of typically so you can remember.
Yeah. That makes it made a lot of I was like, because I knew once I saw that it was androgen sensitivity syndrome, it all made sense. And
Mm,
I never thought about it from the model perspective to look
yeah.
for that presentation.
They always say it's a taller girl, right? They don't have any hair, right? They have breast development, right? And of course, they're infertile, right? And can have undescended testes. So that's the classic picture of androgen insensitivity.
Great. Okay.
It's Kanye West in glasses. That's how I remember this. But anyways, yep.
This is the okay. Um,
Have you seen the picture by any chance?
I don't think I have.
Okay, I have to share it to you so that you can remember. If you stop sharing your screen, let me show it to you.
Okay.
Okay, let me share my screen here. See?
Well, I have never seen that before.
Yeah, so now you know.
Now I know. So
Now you can remember it, kind of.
remember
All
it forever. Um,
right.
yeah, this one I just like I guess I just overthought it and confused myself because like I think it flat out yeah, it brings up sildenafil and
Mhm.
I knew it worked on the corpus cavernosum. I don't know why I didn't pick it.
Yeah, so the erectile tissue, right?
Yeah.
Okay.
So I think I just saw a vasculature structure and just picked it, but
But A is going to be your superficial vein, right?
yeah,
But that's just the outflow, right? But it's not going to really help you with the dilation inside some, right? And then C is what? C is going to be your yeah,
urethra.
urethra, right? And
Yeah.
then I don't actually know what B is. What is B? Is that
What does it
what is
say?
it?
Just
Connective
spells
tissue.
out the
Okay.
connective tissues.
Okay. So Buck's fascia and stuff. Okay, cool.
Mm, yeah. Okay. I kind of knew like the whole plantar flexion and Achilles reflex were together. Like I didn't know what the answer was, so I kind of tried to use some deductions and at least match like this together. But I just had it flipped as to which one the fracturing the neck of the fibula. I didn't know which nerve it did.
Mhm.
So then I just kind of knew to pick one of these two.
Yeah.
So
Okay. Let me see. Fibula of the right leg, struck across the street. Okay. Pain over proximal, right? It's going to be present, right? Because it's distal to that. Pain over distal fibula, that's going to be gone because you fractured above that, right? Dorsiflexion, right? Versus plantar flexion, right? Dorsiflexion is kind of a lot of kind of what your lateral fibula side does, right? So you're going to be missing some of that. Plantar flexion is going to be by your calf, right? Your calf muscles, which is in the back. So you're still going to have that. And then your Achilles reflex, right, is going to be kind of, it's still going to be there. It's not going to be absent. The reason why it's there is because that's your calf muscles, right?
yeah.
So that's how you kind of work through this kind of question.
Okay. Let's see. Okay. I knew I had it down to the diagnosis to either pertussis or the whooping cough. But I mean, I did kind of think it was pertussis, but I forgot that one of the toxins of pertussis increases adenyl cyclase. So then since I had forgotten that, I had no clue which one it was. I just picked one.
Hmm. Did you know it was pertussis though, right?
Yeah,
Okay, perfect.
like the
Yeah.
machine gun like coughing.
Yep.
The only thing that threw me off about it being pertussis was the 70% lymphocytes.
Yeah, that's the strange thing about pertussis. It actually increases lymphocytes. Um, they do mention that in the sketchy. Like, I don't remember the exact mechanism, but it does increase lymphocytes. So
Yeah.
something weird.
So,
Yeah.
yeah. So I just picked one. But now once I like, yeah, once I saw that that was the right answer, I remembered that part of the sketchy with the camp in the background.
Hmm.
Um, yeah, this one, honestly, a good question strategy would have gotten me through it because I was trying to decide between these two, but they're so similar, they wouldn't be, either of them wouldn't be the right answer. And I knew it wasn't A or B because I knew those didn't really have an interference with fertility. But I've just seen some questions before where oral contraceptives, like, because it takes a while to like for the hormones to balance out. So that's why I was like thinking that. But if I'd used exam strategies, there's no reason, since oral contraceptives and progestin implants typically do like the same thing in the
They do the
body.
same thing. Yeah, they do the same thing. The only reason I think IUDs has a little bit slight increase for infertility is because it can cause scarring.
Okay, that makes sense. All right. Yeah, no. So I knew we were talking about necrosis because we had an increased serum activity of creatinine kinase MB. And that just brought me back to the pathoma of the highlight of necrosis is like nuclear lysis, like the nucleus goes away. But apparently, since creatinine kinase is not found in the like in the nucleus, we're talking about other definitions of coagulative necrosis.
Well, talk about this, okay? On a remember, I like kind of teaching on a whole concept kind of ordeal, right? So,
Hmm.
where can you find troponin and CKMB? Like, tell me exactly in the body.
Well, they're in cardiac myocytes.
Yeah, so they're in the cells, the myocyte cells inside, correct?
Hmm.
So if I were to take lab work of your blood right now, would I find troponin in your bloodstream?
No,
No, because it's inside the cell, correct? So all our lab values that we look for enzymes in the bloodstream, that means that it has to have lysed the cell.
gotcha.
Does that make sense? Like you have
Yeah.
to have the cell membrane busted up so that the enzymes can be released into the bloodstream, which is why if you think about it, that's why we run labs like AST and ALT, right? Because those are liver enzymes, right? That's why we run troponins, right? Because that's the heart, right? You know, that's why we run, enzymes in the bloodstream that's not usually there, because then you can locate, oh, what's really going on, right? What organ system is hurt, So that's how kind of those lab values came to be.
Yeah, that makes a lot more sense. And there's a good chance I didn't quite recognize that we were specific. Yeah. It that made a lot of sense.
Perfect.
Okay. Do. Yeah, I don't know my HIV medications that well. So like I knew I could eliminate B and E, but then I just had to pick one.
Gotcha. Yeah, I
'Cause
mean, you
yeah.
know, this is just kind of the memorization thing, of course. Like I said, I wish I could give you a little bit more than that, but sometimes that is what it is. So
Yeah, and that's fine. And that's where I'm kind of like the more I go through and do more questions and put this in the back of my brain, it'll get better. So,
yeah, for sure. Just repetition.
okay. Yeah, I knew reading this question, I was like, this isn't adenocarcinoma because he was undergoing evaluation for occult blood in the stool. It was a 70-year-old man. And then I don't know why I didn't pick it because I think I was thinking adenocarcinoma and I just didn't want to pick adenoma because adenoma sounded benign.
So it
Um,
could, benign polyps can also bleed a little bit too. So the key here is, I mean, I like that you're using clinical, right? Unfortunately, this question, right, was dictated heavily on the picture.
mhm.
Tubular adenomas, I think they mention it. There's like one sentence in pathoma that mentions it, but it's the only polyp or cyst in the colon that is pedunculated.
Okay,
So,
so on
so
that stalk.
yeah, that's the only thing that it has is that stalk. So that's how you would have picked E. But any
Okay.
one of these could, cause, some bleeding and stuff. So
Okay.
really is unfortunately this is just you had to kind of look at that gross imaging and be like, oh yeah, look, it looks like it has a stalk there. Oh, it has to be a tubular adenoma.
Yeah. See, I recognized the stalk in the picture, but then I couldn't remember which one had the stalk.
Gotcha, gotcha, gotcha. Yeah, yeah, yeah. Yeah.
That's always fun.
Yeah.
Um, so I knew we were talking about muscle atrophy in this question. Um, and I didn't actually know the exact cause of muscle atrophy. If it was like smaller cells or dead cells. So that's kind of where I didn't know whether to pick B or D.
B or D, protein degradation. 6 months later, 2 3. Oh yeah, yeah, yeah. Yeah, I mean, myosin light chain phosphatase activity. I think that's smooth muscle. Am I not correct?
Yeah.
So
Or
that's
yeah.
yeah. Remember, when you're dealing with kind of loss of muscles, you're really talking about skeletal muscle loss, right?
Mm, yeah.
Not really smooth muscle loss. So yeah, you just think that if you don't use it, you lose it, right? And so your body will break down that protein,
Perfect.
muscle protein. Yeah.
Yeah. Um, okay. So when I read this question, which of the following areas of the kidney, I knew I didn't diagnose it as ATN. I just knew it was some kind of renal, like acute renal failure. I just
Okay.
didn't, so I didn't get the diagnosis of specifically ATN, but I mean, it makes a lot more sense when you know it's ATN.
Yeah, when I mean, yeah, ATN, you're at increased risk for ATN almost for everything, right? If your drug's super dehydrated, right, shock, right, when your kidney kind of loses blood supply, then it can die, right, and slough off, and it's usually those proximal tubules. So,
Yeah.
okay.